Wednesday morning, everyone. I don't know how many of you have put your foot outside the door this morning, but it was a little bit of a shock to me to get that kind of cold breeze across my face. I'm always looking for at this time of the year for those really nice warm days that makes you think, oh my gosh, is this June or July? But no, it's still May. And I heard on the way into work this morning, John Wilson's calling for frost. So hope you haven't got anything planted yet. And if you do, you better get it covered up because we're going to have a couple cold days yet. But as I say every single week, it's getting better. It's getting better, not just from a weather perspective, but everything is getting better and getting better. And we just have to stay on this path. And this morning, I'm joined by a good friend of mine who is a good friend of everybody's, actually. Hopefully, you don't need to see him too often because that would mean that you're probably going into the hospital and you don't want to do that. But he's a good friend of mine. He's been navigating the turbulent waters, probably more so than most of us through this. But it's always a pleasure to sit down and speak with my good friend, Patrick Gaskin, the CEO of Cambridge Memorial Hospital. Patrick, welcome this morning.
Good morning, Greg. I'm just pleased to be here for that. But I always worry that you could get nobody else for your Wednesday chats. These are awesome to have. It's like I'll call Patrick. He'll talk to anybody.
No, you really want to know what happens with that because I'm sure a lot of people wonder about that. But generally, what happens is staff will come to me after the chamber chat and say, "Okay, who are we going to have on next week?" And I say, "Oh, I don't know. Let me think about it." And of course, a million other things come across my desk, and I don't start thinking about it until Sunday night, and then I get this email saying, by the way, the email blast has to go out on Monday. Really like to say who the guest's going to be. So that's why you received an email from me Sunday.
Good. I thought I was, there was a cancellation. It's like, oh, Patrick, he'll speak to anyone. I'll just email him on Sunday, and of course he'll email me back and said, yes, I'd love to yak with you for an hour.
I'm sure last week the chief of police, Brian Larkin, thought the same thing. Oh well, Greg figures I'm just going to say yes, but I have to tell you that folks like you, who I know are really, really busy, and the chief, of course, last week, have always made time to come and speak to the Cambridge business community. We certainly appreciate that. And I know it was short notice, and I appreciate you making some time. So Patrick, give us a lay of the land then. We're in the third wave. We're kind of hoping that we're at that plateau, but nobody really knows because we got a little bit of a lag. How is Cambridge Memorial Hospital fighting its way through this third wave?
Yeah, thanks. Thanks for the time. So can I share my screen? I want to show a picture first of all. Is that all right?
Yeah, let me.
The host is disabled. Participant screen sharing.
I just have to find you here.
I didn't ask you that if I could do that. I just thought I'd spring that on you because then you couldn't say no in front of everybody for that. That's what I was worried about. It's like, no, I don't want
to. You should be able to now.
Okay, let's see. Super. How do I actually get my? Let me pull that one up. How does that look? Share.
Well, you look great.
Share. Oh, good.
Oh, there we go.
Oh, good. Excellent. Do you see?
Wow.
So you see the picture of the gentleman in blue in the middle. I assume you see that, and then surrounded by the staff. So that's Dr. Jonathan Marhong. That we're in the middle of the ICU. For that. This is a few weeks ago. Jonathan is an amazing, one of our amazing intensivists. So an intensivist is a doctor with special training in critical care. So, they go to school for a gazillion years to be a doctor, and then they go to school for a gazillion plus more years to be an intensivist. Jonathan was recognized by his two colleagues on either side of him for what we call our iCare Award. Our award given monthly to recognize living the values of our organization, caring, collaboration, accountability, innovation, and respect. And they always have everybody in tears as the letters are read to why they should be awarded and recognized by it. And I show this picture not just because to highlight Jonathan, but to recognize, the amazing staff in this organization who for 14 months, 15, whatever we're at now, have gone above and beyond. I can't say that enough. If we think about where we are today, our intensive care unit is usually 12 beds. And because of our new design, we're able to leak out of our current space and add more capacity down the hallway by displacing medical beds, but they have enough technology within them to serve as ICU beds. So our current 12 is now 22. So we've added 10 more. We've nearly doubled our capacity. And I think to the business people on the phone, it's like doubling your business overnight or over a few days as we did it, just the ability to be able to do that, staff and all that kind of stuff. We could talk more about that. But core to kind of being able to do that is actually having the health human resources, having the staff to be able to do that, caring for the patients day in and day out. And so, that is just, it's just incredible for that. So I just wanted to start with that because I think when we ground all of this, we are an organization that is people caring for people, and and what more important time ever than for all of us as we're living through our first, for most of us, our first global pandemic.
What's interesting about this, and when you speak to that, you being the administrator there, you've got to be responsible that you've got the staff in place to care for the individuals that are coming in, but you also have to care about your employees and making sure that they have, not just the tools, but the support mechanism as well, because we hear a lot about the difficulty that healthcare professionals are having on their own personal selves as a result of this. How have you found your team rallying around or some of those types of issues within your network of healthcare professionals?
Yeah, and it's top of mind for in both in thinking and action for our organization. And if we think about wellness of staff, I want to sort of elevate it from wellness is often kind of individually focused. So Greg, eat better, exercise more, get more sleep, stop drinking, all that's kind of, people think of wellness. We're taking a holistic approach here at the hospital where we talk about the well-being, the wellness and the well-being of staff. And when I mean by well-being, that's the organizational responsibility for it. So we've had a commitment, a multi-year strategy where we are focused on improving joy at work. That is a deliberate language that we use. We talk about the joy of work because people caring for people is a joyful activity. It is one of the most essential basic things that humans do to each other is they care for each other for that. So and there's joy in doing that. But as organizations, we can, at times we can stamp that out or we can dampen that down. So when we think about joy, it's more than, Greg, eat well for that. It's about how the organizational environment is. Is it a psychologically safe environment? Do I feel safe at work more than my PPE? But is my boss nice? Did my boss yell at me all the time or whatever? But that's not you're not feeling wellness and well-being if you're getting, yelled at all the time for that. Do I have choice and autonomy in what I do? Can I focus on the things that are really important? Have I been able to give some flexibility within my work environment? Again, really critical. Do I understand why I'm at work? Do I have purpose of why I'm contributing to the work environment for that? And is it like a team environment? Do I feel like I've got great colleagues for that? So for us, we have had a laser focus on well-being, on joy within the workplace. We have focused on meaning and purpose, camaraderie and teamwork, choice and autonomy, psychological safety. Those are our 4 top themes for it. And so now, through this, as we think about where we are right now, it's elevating that within the organization. So, like clearly top of mind for us. So I could take any of those 4 and talk about what we're doing on those. If I think about psychological safety, we've begun, as many organizations have, a deep focus on equity, diversity, and inclusion within our workplace. So asking our staff, what is it like to work here? Do you feel safe for that? How have you seen have you seen discriminatory actions expressed to you or your colleagues for that? Just completed a survey, 350 plus people completing that. Selecting members for a diversity council right now to advise the organization on how to move forward. So that kind of theme of psychological safety, there's one example. Meaning and purpose, we're updating our values. Our 5 values are critical to us, and we're not changing those, but kind of making sure that they really resonate with staff. So kind of, again, meaning and purpose is pretty easy in healthcare, but at times gets lost. Camaraderie and teamwork. Tomorrow night we're doing virtual trivia night for the staff. In spite of everything going on, just how do we have some fun within the organization? Yesterday we celebrated our colleagues at Toyota Manufacturing helped us celebrate May the 4th be with you. Toyota, I should say, not Toyota Manufacturing, but Toyota. Manufacturing help us celebrate May the 4th be with you within the organization. It felt like I was on a starship actually, as walking around for that. And then as we think, about choice and autonomy, the work we do around quality improvement and process improvement within the organization, how do we structure things? How do we improve staffing? How do we improve things? So like for us, like well-being, I'm glad you actually started there rather than how many COVID patients do you have, Greg, for that. But I was like I, want to sing from the rooftop. I think how important that is for us, because at the end of this, if there is an end to this, I am worried. I'm worried about the effects on staff. I know you probably have another question, but I want to give you a story first of all.
Carry on, dude. This is your hour.
This is my hour. Okay, Greg, you can sign off. I'll run it from here for that. So let me give a story. One of our emerge docs works also in GTA emergency, and a few weeks ago he said to me, so he works in the emerge there. So he said to me, just like one of the worst days ever. Like the GTA is on fire. It's on fire, and we'll talk more maybe later about how we're helping support that. So what he said is, I'm, just the number of COVID patients. So in the emerge, speaking with a patient, and you're working on goals of care. Goals of care is what do you want? What are your resuscitation? It's like when we talk about goals of care, it's like, well, what are your goals here? You're coming in. What you want as your goals of care. And so as part of that, he wants to call the spouse of it. So he's on the phone trying to call the spouse of the patient. No answer. It goes back to the patient. I can't get a hold of your spouse. No, my wife died of COVID last week, and I don't care whether I live or die. And he intubated the patient as the patient agreed to, and the patient died by the end of his shift. And so, I don't think that story just resonates so terribly with me to realize like this is a devastating disease, continues to be, and affects families, multi-generational families. We have patients here whose loved ones are at another hospital, patients here who, when we call their loved ones that are at home, don't know where their other loved ones are because they haven't yet heard from that hospital yet for that. So as we think about where we're at, we see light at the tunnel. It just seems a long tunnel to get there. But I think at the core of it is just that relentless focus here and across the province of us working as a system of healthcare to support the care of the patients. And I'll stop.
I wonder, when you talk about that, I think it's really it's really interesting because if you think back, not a year, but say 10 months ago, when things, the caseload started to go down, we started to look like things were slowly coming back into, regular routine. We had really not a normal summer, but as normal as you could possibly have without vaccinations going on and things like that. So, and things looked kind of, okay, like we had things under control. Yes, the experts were saying, hey, don't get too comfortable because we've got some darkness just around the corner. But I think for most people, they kind of thought, well, we got this under control. The experts got this under control. Our healthcare professionals, they're monitoring this. What kind of an effect does it have on the healthcare professional who is, knows exactly what everybody's got to do to keep us all protected. And then all of a sudden, the floodgates kind of open and the backyard parties happen and the group gatherings happen. And oh my gosh, and all of your staff are sitting there saying, shaking their head. They got to be shaking their head and saying, like, what's going on? Like, we know now we're going to have a horrific winter. How do you deal with that? How does staff deal with that up and down frustration with just, the normal things dumb things that people do and don't listen to the protocols? How does staff deal with that?
Yeah, yeah, I think we all had this arrogance, right? That we'd have one wave, and somehow we in Canada or Ontario or Cambridge would somehow, weather through this, and it wouldn't be, we wouldn't see the subsequent waves that everyone predicted, right? In the summer, they were talking about the fall wave, and lo and behold, the fall wave comes, and it's clear. I think the frustration is so much of this is preventable by all of us, right? You get this through human contact. You don't get it anywhere else. For that, you're getting this through human contact. And how do we minimize that? And recognizing as humans, we set our own rules at times. We recognize or think that it won't apply to us. Some people, have to go to work for that, and their employers maybe aren't creating a safe work environment. And so, to the people on the screen, I mean, we all have an obligation to actually create safe and work environments in order to enable and encourage and enable a healthy workforce for that. So it's frustrating, but for us, it just comes back to just being at the ready as we were through wave one. Wave one was, like, I'll say this, I don't know if our staff feel this, but wave one was a bit sort of disappointing. Not, and I don't mean that in a weird way, but like, we braced ourselves as like, oh my gosh, we ramped down surgeries, all that kind of stuff, and the wave didn't come. For that. Not that we're happy that this wave is here, but by the third wave, we're actually like, it's upon us. So as we think about that, when I talk about having gone from 12 to 22 ICU beds, we've also jumped like 40 medicine beds. So we've actually sustained and kept open, almost through all of the waves for it. So we've added that capacity. We've added nearly 300 staff to the organization. Wow. New staff, and we've had about 300 staff move departments. So as you know, we have a COVID assessment center we opened up. We've got staff screening. So I mean, staff have moved around departments for that. And so that in terms of just I walked down the hall. It's like, I don't know who are these people. You should know everyone. Like, who are they? So like, just as we this we had the 2 dress rehearsals, and I don't want to diminish the amount of work and the amount of care we provided, but now a couple of weeks ago, Dr. Lee, our deputy chief of staff, and I were touring on a Saturday or Sunday, and it was there were, I think, 16 patients in the ICU at that time, and almost all of them were COVID positive. And I think every single one was vented. It was like, I've never seen this, like, and ventilators, we don't have a shortage of them. PP, we don't have a shortage of them. I just, holy smokes, like, just that, that impact in terms of the care that these patients need. And then remember, as we think about that, those patients are staying for a long period of time. They might be COVID resolved, so their COVID maybe finished, but they're still really sick. So today or yesterday, when I looked at it, I still had 17 in the ICU or 18 or something like that, and only 5 were technically COVID. There would be a number that were COVID resolved for that, who haven't got well enough and may still be vented, but may no longer have COVID. So it's a long journey for that. And maybe I'll just segue to kind of the work that we've done around transferring and supporting the transfer of patients from the GTA. I think it's been so essential to see the healthcare system operate as one. And it doesn't really in the past, like, that's not the way the healthcare system works. Hospitals are each their own corp and all that kind of stuff for that. and for that. So, but it has really, I'm proud to be part of a system that is a oiled machine. I won't quite say it's a fine oiled machine yet, but it's an oiled machine of the way transfers are actually happening now. So hospitals identify those transfers. There's a coordinated way of doing those. For that, about half of our patients, I think, that we're at any one time now are coming from the GTA for that, and they're coming either directly to the medicine units, they're coming into the intensive care, and by adding that extra capacity, we've added the staff. We've also essentially doubled the physician workload, or double the physician coverage for that. So physicians, where we used to might have one intensivist with those 12 patients, now we have two intensivists for that. So everyone's kind of moved the game up around that, and that those patients are scheduled and arrive. It's not like a chaos, like a MASH unit or something where all of a sudden someone's just showing up and everything like that. So it's a well-oiled machine in terms of kind of how that works. People may remember the government a few weeks ago took away the patient's ability, that we could still do those transfers if patients didn't consent to the transfers. And again, that just allowed it to happen. I think in most cases, people are trying to encourage that consent and things like that. But if push comes to shove and there's no capacity at a particular GTA hospital and there's capacity across the system, we need to move those patients. And we've made a deliberate effort now to, as we receive those patients, to connect with their families. Some people, oddly enough, don't know where Cambridge is. So we're putting you on the map, Greg, for that.
Perfect.
So, we explain that, and they won't need a passport to get here or for that. So we just help them understand that. For that, but we introduce ourselves to them, and they get to understand and meet the care team, which again I think is really really critical for that. But to see that system working provincially, I think has been just sort of very critical. And then we can drill down and talk about that at a local level. And but I'll stop rambling for a moment in case you want to go somewhere else.
It's just an interesting philosophy when you start thinking about the emergency situation of an individual that maybe needs to be ventilated, or ICU care, and there's no capacity in a GTA hospital. Put them on a helicopter and take them to Cambridge because there happens to be a spot there that they can fit in. And I often wonder, when you were talking about that, I thought, what is the reaction from the family when they, by the way, this is I'm Dr. So-and-so from Cambridge Memorial Hospital, and I've got your husband or your wife or your daughter or your aunt or whatever here. What is the reaction, and what is the how are those conversations?
Yeah, and we've been, I think largely very positive. I mean, people are really appreciative of the care, and people, are amazing, like in terms of kind of just, in terms of us reaching, like very thankful around having made that connection. And then, through our patient and staff screening program that we have, we do virtual visits. So often travel's an issue for people, and they also maybe have COVID, maybe not as seriously, but they're at home. So we arrange a virtual visit, whether that's in the medicine program in the ICU for that. So like just for them able to connect with their loved one, and those are hopping. Like we do a whole bunch of them every day. We got a team that actually goes out and sets up one iPad, sets up the virtual visit, goes on to the next room, sets up the next iPad for that. So again, I think it's how do we connect, and that proactive reach out by our patient experience lead to kind of do those connections to it, or a member of our spiritual care department who do those reach outs, I think are really just give some assurance that oh, okay, I'm actually starting to make a connection. I'm starting to understand who the people are at Cambridge and starting to get to know them. And so yeah, no, I think they've been largely really well supported. And then we help enable them, whether it's to visit or whether just actually to get home too, because at the end of it, their loved one might still be in hospital and stuff like that. So we arrange for transportation to get people home. And then we play Here Comes the Sun. Every time we have a COVID, it'd be awesome if we get one in the next half hour, but like we play Here Comes the Sun, and it's just like puts a smile on 1,000 people's faces in this organization, because everybody's just beams when we hear the Here Comes the Sun being played.
That's so remarkable, because we're and it just really demonstrates the crisis that we're in. And, you know, some of us, I guess, to some degree are maybe a little insulated. We maybe haven't had a family member get it. We haven't had it ourselves. We're, you know, doing all the right things to stay protected. And we hear these stories, but we don't experience them. And to really understand, you know, it really needs an individual who's kind of on the front lines and seeing this happen every day. And you mentioned about, you know, new people coming in the hospital and walking down the hallway and you don't recognize them. You're going to have to start getting them to drop the mask every once in a while, because just to let everybody know, before we got on here, I had a conversation with Patrick, and because we're doing the rapid screening kit program, and I'm kind of giving some advice on how to use the kits and how to interpret their results. I was on a call, and Mayor Barry Verbanovic was on the call, and you know, I heard him yell out at one point, I can't believe what we've come to when DeRocher is giving medical advice now. So Patrick had a good laugh about that. So you might want to just, you know, because you never know whether Dr. DeRocher will be in the hall.
I better, yeah, yeah, if I see you with a name badge on, I'll be, who is that? When did we hire?
It's also interesting to hear the ability to ramp up so quickly with staff, because, you know, we always hear of shortages of healthcare professionals, but I know some of the institutions around have really ramped up their programs as well to make sure that that we continue to graduate these young people that we need. We now need them in the healthcare system more than ever, and probably post pandemic, which, you know, we hope there will be a post pandemic. You know, we're going to have to really give some keen thought to this, because we found out there's two really vital parts of society in the 21st century, and that's healthcare and the economy. And both of those have got to be principal components going forward of decision making, whether it's an administrator like yourself, whether it's the mayor of our community, whether it's the prime minister of the country or the premier of the province. You know, those two things have to be core values, and take a principal role in decision making going forward. We cannot be unprepared when we know now exactly in modern day what happens during a pandemic.
Yeah, no, I think it's absolutely critical that because we've kind of probably always known it. Like, you got to have healthy people in order for them to work and generate a strong economy. So, you know, that intertwining of them is absolutely critical. As we talked about being able to ramp up, I think I do need to stress, because it comes at a cost. We talked about the human resources, just kind of the effort and the kind of how hard staff are working here. But there's also stuff we're not doing right now. So, I think we can't underscore the fact that to ramp up, we redeployed 30 plus staff from our operating room and our recovery room in order to support the expansion in our ICU. So those nurses and anesthetists, have good experience in working with critical patients, but do need some top up in education and things like that. So we offer and arrange that. Which is fantastic. And if you think about operating room nurses, or particularly recovery room nurses, you think, well, they're highly skilled because they're doing airway management and they're doing their vital signs monitoring, and they've got lots of skills to be able to contribute within an intensive care environment. But the flip side is that we're no longer doing those surgeries. So we on a normal day, kind of running 7 ORs, we're running 2 now. And it's urgent, emergent cancer surgeries, like, the critical things that need to happen. There's a whole backlog of cataracts and hips and knees and other stuff that needs to be done, and screening procedures and things like that that need to be done. And so, we think about, as we come to out of this, or to a different, to a valley of our wave, once again, we will pivot, as we all say nowadays, and ramp back up our surgeries to be able to do that. But there is a huge unmet need or delayed care that is of great concern to me, because we think about, this is so important and we focus on this now, but there's a community out there that has got cancer that's not being diagnosed for that. So in this wave, as we've ramped down, wave one, we ramped down everything, right? There was that fear. Nobody actually left their houses, except it was great to come to work for that, because you can drive here
Traffic
quickly.
was great.
Like, everybody stayed home, which is what you're supposed to do now, folks. So I'm not sure why you were all on the road this morning as I was coming to work. But so, in that wave, we ramped down. In this wave, we are keeping things like diagnostic imaging going we're keeping most of our clinics going. So we keep our clinics and our services running on an outpatient basis if they can't be redeployed. So diagnostic imaging does great stuff, but there's very few nurses in there that could be redeployed to ICU. So let's keep diagnostic imaging going. It's really important. We're doing screening, we're finding out things, we're meeting the needs of primary care, we're keeping things moving forward for that. Let's keep our outpatient services. We want to keep, our mental health services, our CPD, things like that. Keep them running. Now, if we have to redeploy some of those staff, we'll make those adjustments. But that delayed care is really concerning for that. And so, and then how we'll work as an organization to kind of deal with that backlog will be absolutely critical. And our ability to ramp up, our ability to give some staff a bit of a break. For that, but be able to ramp up, and we're not out of that wave yet. Can we celebrate something good? Can I put another thing up on the screen?
Yeah, sure.
Let me see if I can figure this one out. Oh yeah, there it is. Okay, so do you see? Oh no, you have to hit share. There we go. Okay, so just on the ground floor, we get this report every day at about 8:30. This is our hot off the press for that. And so no tweeting this out, because somebody else does in the province or whatever. But this is our like, and I open it every morning to figure out what's happening, because this is our ICU capacity in the province for that. So you see that kind of 880 on the screen for that. That's what and you see the top graph and the top bars for that. You see we're kind of at that top, it is a good situation for that. We crested on May 1st at 891 ICU admissions, ICU. And so, if you'd asked me if we'd been doing this 3 weeks ago, Greg, I would have been just off a provincial call, which said that 800, we were at 600 at that time. And that they were saying we're cruising to 1,600. In other words, we're going to go to about 3 times that volume for that. And all the projections, and we were right on the projections, like all the way up to, it was at 697 actually. And they said, and they showed you their model, and then the actuals is like, oh, this is frightening, because they're just like spot on in predicting this. So we were at 880 for that. But so we can celebrate that. But that does not mean businesses can reopen, Greg. No. That does not mean the public health measures can be relaxed. We're running those 880 ICU beds across the province with all of that ramp down, all of that redeployment. And the message to the audience and our colleagues is like we've been talking about all May, we'll need to continue this kind of flat out maintain that capacity, because it will be a very slow decline, right? So yesterday was 881, I think it was. For that, but that 53 is the 53 new patients yesterday. I think what was yesterday's number, like 60 new patients yesterday, 64 yesterday new patients. So some are getting out. We're still seeing patients. While the numbers, the provincial numbers are starting to come down. Each of those numbers you see yesterday, 3,000 or whatever for that, not a good portion, a portion of those are going to end up in the ICU in 9 days for that, right? So this isn't like, oh yeah, great, good, look, the numbers are coming down, we can open. Yeah, maybe in a month. For that, but so we'll take a small celebration in the fact that we aren't, at least for the last 5 days, then we stopped it on May 1st, but that hopefully we keep everyone working there together. We'll keep we'll keep going down slowly, and with a lot of kind of hard work over the next month of not providing care in the operating room, and redeploying those staff and keeping those intensive care beds and everything else working at 100% for that.
Yeah, it's so important. We talk, often, you and I have talked in the past. We talked about it, with Winnie, when you had Winnie on or arranged to have Winnie on for us. How important it is that we follow the protocols and we do what we're supposed to do. because it's really about everyone else. It's really about those around you, whether they're your family and loved ones or colleagues that you work with. It's really about doing something for somebody else. And if everybody does something for somebody else, then they're actually doing stuff for you too, to keep you protected. And I think that's what's so important about it. Before we get into a couple of questions that are coming up, and I'll ask folks if they've got any questions, but I just want to, we never had that opportunity to, I think actually the last official chamber event was business after hours at the new hospital.
March 9th, March
Yeah,
9th. And I wondered if we were canceling it. It was a Tuesday or Monday or Tuesday.
that's
I don't know
right.
if we're going to cancel this.
And I remember all of the hand sanitizer stuff around, and we were,
Yep.
you know, we were using it like crazy, and you know, it kind of was an odd feeling at that point, because you knew that something more was going to come. But you know, I think the sad part about it, from not just the whole devastation of the economy and people that died and, you know, the illnesses, but the sad part about it from our perspective was we really didn't have that year of celebration of this magnificent new facility. And how though, if you look back, Patrick, and you think of all the trouble it was to try and get that building in the ground and built, um, how what impact has that had on our ability to be able to deal with this pandemic? And you know, you think back, man, oh man, if we'd have been, you know, 1 year later, boy oh boy, we would have really had some challenge. We'd have been halfway through a construction project, and all of a sudden we'd have had this and had to deal with, you know, using the old facility. How important has it been for you folks to have this new, bright, new, shining facility?
No, and you know, we really never got to celebrate it as an organization or use it in a non-pandemic world, right? Like all of a sudden, you know, and so, you know, things like, you know, the intensive care, which, you know, if the pandemic had happened a year earlier, the intensive care was, you know, sandwiched in a temporary area. It just couldn't have worked with kind of open bays and stuff like that. It's just crazy versus what we have now. And I spoke about that ability of our intensive care to leak out and move down the hall. And that again was part of the design, is that ability to temporarily expand it, and offer care, you know, kind of outside the physical walls, but be able to do that safely. And then in terms of the kind of negative pressure rooms, in each of the programs. Like, so we have them in obstetrics, mental health, we've got it in peds, like we've got it kind of everywhere. We've got a negative pressure room. Now it's, COVID is not transmitted aerosolized, but, you know, just having that, if they are doing any aerosolized generating procedures, they've got those available for that, or, you know, on each of the units. So that, you know, it has been marvelous to be able to have the facility for that. And then even as we added that capacity, so we had empty units in our wing B as a result of moving several of them to wing A. So we were able to, and have been able to, expand that capacity as a result of that, and added those extra medicine beds I've talked about. And now, more excitingly, is we're about to enter our final phase of capital redevelopment. So, you know, this, which is, you know, this has been a long road for this community for that. And so we've signed a contract. Ellis Don is our contractor for the final phase of the work. The work has started already for that. So there's internal disruptions within the organization right now. We are on a plan to vacate Wing B. So we actually have to get everything out of the inpatient tower in Wing B. So the 3 levels of care there that we offer inpatient care, and move those to Wing C. And so we're working on the timetable for that towards the fall and into the winter in terms of what that will look like for us. And then, you know, undertake that renovation of Wing B. And at the end of the day, when Wing A and Wing B are done, they'll look very similar. They won't have the floor to ceiling heights, because it won't be as as spacious in the same way, but the room designs, like we got the Wing B, like completely got it. And so in terms of the kind of the way it's designed, we're aiming that there will be no ward rooms in Wing B. So right now we had a ward room on each floor, and because we haven't done the building yet, we have had conversations with the Ministry of Health to say, you know, do we really want to build ward rooms in Wing B since we have this opportunity to not build them? So they're favorably, we're in favorable conversations with them about doing a small redesign of that and taking those 4 bedrooms and essentially putting a wall down the middle and having you know, two bed rooms for that. You know, and if that comes to pass, then at the end of the day, we will only have 2 ward rooms in the organization at the end of the day for that. So, and Wing B renovation, like Greg, you and I are going to be older, and I'll have a lot less hair, but it's going to take us like 4 years. And it sounds like, wow, it's a crazy long time. It is a crazy long time. It's a complex work. We are renovating completely diagnostic imaging and lab, which are on the main level for that, and running those. So it's not like we're closing those down and running those. So multi-phase renovations of those areas, and then the complete you know, gutting of the inpatient. And at the end of the day, medicine, surgery, rehab units kind of completely redesigned for that. And we'll have, again, negative air pressure rooms on those. We'll have, again, that added capacity within the organization, which is just fantastic for this community to be able to have a state-of-the-art hospital for that. But yeah, which is just, you know, we're tickled pink around it, but a long, you know, a long journey ahead.
Mhm.
And we, you know, our foundation celebrated having raised the 50 million for that. We've told them we have lots more equipment needs beyond that, and I can see Kate Cressman there, and she knows her and her team have, you know, stepping up in terms of the ongoing, you know, programs and services that we want to continue to offer. So and the equipment that we need, we're equipment pigs. We just eat everything we possibly can get our hands on for that. So yeah, so there's still more work of our foundation and our community in order to support the hospital beyond just kind of the Wing B work.
Yeah.
Work ahead. We haven't talked about vaccinations yet, Greg. Are we going to
Oh,
talk about how exciting? Like, we got to talk about something good. Well, I
I'm
mean, Wing B's good and everything like that. And for
Well, I
that,
told you that you know, everything had come into balance after I got my Pfizer.
yeah, you don't care about anything anymore now.
I'm you know, everything's okay. You know, we're good now because I've got my vaccine, at least my first shot. But yeah, well, go ahead.
Yeah, well, I mean, I think it is. I think, you know, this is, you know, so, you know, I think businesses play an important role around encouraging vaccination. So, you know, clearly our healthcare workers here vaccinated. Most, if not all, of our staff have had. Everyone's been offered it and all that, and many of our staff have had first and second dose, and some of our staff have had first dose, and then we'll wait for second dose. I mean, I think, as we think about as we go forward, we're going to get that we're going to get the big push, and lots of people will get immunized, but not everyone will. So I think as leaders, and the people on the screen, is like, you have an important role in advocating for that, in encouraging your colleagues around dealing with vaccine hesitancy for that of your staff within your organization. You know, you set a bar. You know, there'll be that group that will be hesitant, and, you know, you can help encourage that. And, you know, the mantra has been like, get the vaccine offered to you. And my nuance on that would, given the latest stuff that's come out of NACI, is get the vaccine offered to you in consultation with your primary care provider. So what does your nurse practitioner, physician say that's best for you? But get vaccinated. And as leaders, we have a really important point, role in encouraging that. Because you know, I was listening to a piece around herd immunity. Like, herd immunity isn't some static thing. Like, the herd, members of the herd die, new members come into the herd. Like, it's not like some magic we're going to achieve and then be done, right? So it is going to be, you know, something that we need to continue to encourage with in terms of the vaccine. And then, as we've seen in this community, like, just amazing work, partnerships with our primary care, the work that the vaccination clinic at Pine Bush, the one at Langs, what primary care are doing. The hospital's been helping support the Cambridge North Dumfries Ontario Health Team one that's operating within Langs for that. So again, everyone coming together to this really important work is critical as we move forward.
Yeah.
But they can only, you know, put needles in arms of people that have got there. So it's really so it's great. You've done it. I'm sure you tweeted that out, Greg. I'll go back and like it. I forgot I missed that one to like, but I think, it's really important that we have it. And then, Greg, we should talk about that antigen testing. Like kudos to you and your colleague at the KW chamber in terms of advocating moving forward rapid antigen screening. Like that, I think a game changer for the system and so important about that. So why don't you tell us about that program?
Oh, it's a wonderful
Greg.
program. I screened negative this morning, so just so everybody knows, I'm free and clear. I can touch things. No, I can't. You still can't do that because, as you mentioned, this is a screen. This is not a test, and people need to understand that it is simply another tool. It's like wearing a mask. It's like physical distancing. It's like washing your hands. It's all of those things that public health have been saying for you to do to stay protected. The screening tool just gives you an extra little tool nobody with symptoms, anybody with symptoms. I get calls all the time. Hey, I got, an employee called in and they're not feeling well. So, I thought I'd bring them down to the office and have them screen and see. No, if they're not feeling well, that's indication number one. They need to go get a PCR test. End of story. Don't come to the workplace. Go straight to PCR and get your test. So, I think you're exactly right. What a lot of business owners have been saying is now, with this tool, it's actually going to enable me to manage my company through the balance of the pandemic, right? Because, everybody worries is somebody in my workplace bringing COVID in unknowingly, because they're asymptomatic. And then could affect another employee or themselves. So, I think it's
kudos. Well, and there's just like one of the members of the chamber, like I had a call completely unrelated to this, and they talked about how one of their staff had tested positive, and while they're working remotely and everything like that, they the staff wanted to get tested. They hadn't really interacted with that staff person, and just the anxiety that it brought down for everybody getting. For the work you've done, Greg, they had those kits in their at their workplace. They were able to give their staff that assurance and the anxiety. So like it's a I said, oh, you have to tell Greg like a lived example of just how and without that the workplace would have been disrupted. People really worried about it and all that kind of stuff. And it's just really it's another tool in the toolkit. And behind the scenes, there's been a bunch of us been advocating for it, and I know there's still frustrations, Greg, as you say, kind of working with the Ministry of Health around some of these things.
Well, that's
bureaucratic. But like, good.
Doesn't have anything to do with the kits, and it's just people. Bureaucrats want to cross too many T's and dot too many I's. We out here in the business, we just get things done. We just
So kudos to you, like fantastic. That was so good. And to the businesses, they need to kind of keep doing that and keep screening and keep encouraging this.
It's kind of a serial process. You have to. It's just like answering those questions when you go into work every day. It's the same type of thing. Just keep screening and keep monitoring. And you mentioned you touched on it. But you're exactly right. This is as much a mental health tool as it is anything else, because people feel more comfortable to go home from the workplace to their families. They feel more comfortable going into work knowing that there's this extra tool to give them some reassurance. So it's been very good. I just want to get to a couple questions before, because you have a meeting to go to, and far be it me being the excuse you're late. That would not be very good. But what about dialysis units? Carl Kiefer asks, what's the latest update on CMH getting a dialysis unit?
Yeah, so I'd love to say we've made progress, so nothing new. We continue. So just for people to know, we've been advocating and support having a dialysis program here. And it's not part of Wing A or Wing B. It would be actually in Wing D. For that, and we've continued the dialogue with Grand River, who absolutely supports it as our regional center for that, and the ministry. But I'd love to say, Carl, we've made 5 steps forward, but we've continued dialogue, but made like no steps forward for that. So it's still in our plan. It's still something we want to absolutely do. And there's been some conversations again, just back and forth with the capital branch, but it has not advanced at this stage.
Okay.
We'll keep at it.
Scott from Jocelyn asked, in your estimation, if you could bring all surgeries back online next week, what do you estimate being your current backlog?
Yeah, so it's a really good question. We've talked about, a year to two to get done it. Like if you think about a backlog, right? You get up to 100%, you can't, 100% is never going to deal with your backlog. You're going to have to go to 110 or 120. I mean, some estimates have been, and I don't have that. We know that data actually. It's a great question, Scott. I don't have it at my fingertips. We kind of track our wait times and our wait lists for that as best we have those. And so I don't have them, but we've been talking months, but more likely actually years to kind of deal with the backlog, which is that's like super concerning for us here for that to be able to deal with that. And yeah, so it's
Yeah.
absolutely
Well,
critical.
that's the next chamber project. I'll be doing minor surgeries on Friday.
Good. Okay, great. I like that. By Zoom, like just, yeah.
Yeah, just cut here.
Here, yeah.
Patrick,
Lord.
I have to tell you that, I think from our perspective and most people in the community, even people that don't know you, but more particularly people that know you, and there's an awful lot of us that know you, having you at the helm during this pandemic was absolutely pure luck from our community's perspective. We have a champion that really knows how to communicate and deal with people and to keep that positive atmosphere flowing. And I know we had some conversations around in the first wave about, people hesitant to go to the hospital because, they thought, well, they didn't want to go because COVID and, and you encouraging people, look, if you feel like you have to go to the hospital, go to the hospital.
Mhm.
That's why you're there. But I think that positive communication from you and always looking at the bright side is really what gives us a lot of confidence. And we just can't thank you enough for what you do for our community and for the people that work at CMH that all take care of us every single day.
Well, thank you. And like, I'm glad you had mentioned, like, if people are feeling unwell, like, absolutely come to the hospital. You're feeling for like, don't avoid care. And that's what we worry about, people like sort of delaying care. And so where they don't, like, where you need the hospital's here 24/7. And absolutely. And Greg, like about a year ago, I was recognized by the chamber and for my I won't say it out loud, but my recognition.
Lifetime achievement.
And I keep it nearby, Greg. And so on a bad day, I kind of chew on it because it's like, it's made out of metal, people. It's like, oh my gosh, her day is just driving me crazy. And so like I actually do keep it near. I put it a little closer so I could grab it, but I do keep it near. And it's just, it inspires me actually, because I think it's, there's still work ahead for this organization. There was a question about stats on staff vaccinations. We don't actually keep them because actually, the world's a bit weird. Staff do not have to declare to us that they've been vaccinated. Like, there's a privacy issue around that. And so as a result of that, I sort of avoid even asking like how many, because we don't really know. Now we try to really encourage it, and we really want staff to get vaccinated. And I'd like to say a really super huge portion of ours have for that, and those that haven't have either medically reasons or other reasons for that. But we had a good uptake when we approached the staff for that. There was a call for that around that, but we don't actually keep the stats, and it's not mandated. So at this stage, like, it's not, vaccinations aren't mandated, so we can't therefore require it at this stage for that. So I thought I just want to answer that question.
No, that's good. And there was just one about recommended timelines for I don't think that you want to answer that.
No, but I think, like, I mean, a vaccine is good. Like, mine's 16 weeks. Like a lot of people are like, let's just go with the flow, folks. Like it's going to work for that. And they've talked about moving that up and whatever. Good. Like, somebody's going to decide things for us, you and I, Greg, and we're just going to do them because that's what we do for that. So I don't know.
Yep.
I don't know. I think there's a win. I think everyone's moving to following the guidelines. Like, I think for that. So I think let's just go with it.
Yeah, I'll go get one every 16 weeks.
Yeah, I don't think that's recommended yet for that.
So, and okay. The cross doses thing, I think, is a medical expert.
Yeah, no, again, I think though, there's going to be some science and some stuff being done, but let's all wow, we got a vaccine for that. And so, and if you think things like Shingrix, anyone that's got Shingrix, you wait 6 months. Like, there's people kind of freak out. Oh my God, when we're going past the 3 weeks, like, you got a vaccine, and it's pretty darn effective for it. So as long as you're still doing all your public health measures, because the virus is still around.
No, that's good advice. I think if we were having this conversation a year ago, we wouldn't be expecting that we'd be getting our vaccines right now anyway. It's been remarkable science. It's a miracle, actually, of sorts. And just like you, being the leader of our community hospital is a miracle to have you there. So thank you, Patrick, and we'll let you get off to your next meeting.
Thanks, Greg. It's really a pleasure. And so as you say, you were saying you learn and plan ahead. So don't wait till Sunday night to pick next week's.
Greg, no, I won't.
Give them more than 48 hours.
Well, it's, I like to put the pressure on staff a little bit,
Yeah, you do. Yeah, right. So it's been a pleasure.
Thanks very much.
Thank you. Take care, everyone.
Yeah. Well, folks, there you have it. Our CEO of Cambridge Memorial Hospital, great individual, just the absolute joy to deal with and work with, very community minded, and as Corey Kimpson said, our community is fortunate to have that team at CMH, and certainly Patrick leading that team, and they're all great people. And as he spoke about, I think we all recognize that healthcare is really important. So we need to support our hospitals, and for sure do what we can to help. Some will have a better ability than others, but we need to remember that healthcare is really important. I don't think for every single one of us on this call, we will not forget 2020, 2021 as a remarkable change in life as we know it, and bringing the values to mind that are really important to everyday living and everyday working. So if you haven't got your screening kits, you're welcome to go online, chambercheck.ca, and you can screen your employees. It's fun, it's easy, and it makes you feel really, really good, especially when it's negative. Not so good maybe when it's positive, but very good when it's negative. Ladies and gentlemen, have a great week. Stay positive, test negative. We're all stronger together. Have a good one.